5 indications that weak gluteal muscles is the root cause of your back pain. I hinted to this in the last video, but sitting for long periods of time can cause tight hip flexors. You have to remember that the main function of the gluteal muscles are to extend the hip. So sitting for long periods of time can actually inhibit those muscles. Number 2, not only do you have lower back pain, but maybe you also have hip pain, occasional knee, as well as foot pain, specifically plantar fasciitis. If you have a glute problem, then your gait is also going to be altered, which is the way that you walk or run. So this can directly affect your joints in your lower body. Which brings me to number 3, your actual gait. So when you take a stride, do you extend the hip a little bit? Most people do not. People usually lazily walk like this, where there's no actual extension in the hip. So here's a couple tests that you can do on your own, which may indicate weak gluteal muscles. You just go ahead and you stand on one leg like this. And so this is a negative test. This is good. So if you go like this and your hip kind of drops down like that, that is positive. That means that you have a weak glute med. And lastly, when you do any kind of squats or lunges, do you feel anything in your butt? Yes, you will feel it in your quads, but if you feel nothing there, then they are asleep. Stay tuned for the next video where I will show you how to do targeted exercise to activate the glutes, as well as stretch the areas that might be your problem issues so that you have more balance.